In all of the time that I've been practicing law, I've worked on dozens, if not hundreds, of drugs cases, from low-level street possession in my early days up to some of the most enormous drugs conspiracies and importation cases that we've seen before the courts, the largest of which involved the importation of over £550 million worth of cocaine by one single gang. I've thought a lot about how we can reduce the harms from drugs, and in particular those harms that are most important to people. So that's violence and death on the streets as a result of competition within the drug trade. That's the terrible health impacts on drug users of adulterated drugs, the deaths from overdose, of course, which have gone up and up and up in recent years. I've travelled all over the world and I've seen what works and what doesn't work. I've travelled to the United States and I've seen they have 2.5 million people almost in prison, many of those because of the prohibited drug market. And I've travelled to places like Switzerland where they have medicalised, as it were, the supply of heroin, and they've not made it a criminal problem, they've made it a medical issue. And they are protecting the lives of users by giving them access to regular, low-cost, safe supplies with a known percentage of heroin in it. So massively reducing overdose, massively reducing cross-infection as a result of using and sharing needles, and most importantly they are creating safer streets in Switzerland, because gone are the days of public drug use and needles in children's parks, gone are the days of shootings and stabbings on the streets over turf wars to supply heroin. I can foresee a situation where we have a legalised, licensed and regulated drug market in Britain, because it's the only way you get rid of some of the harms that we're seeing in such huge numbers across our country today.